I met MJ Brown a number of years ago, and since then we've done some work with Mo Mondays. So welcome, MJ, to the program.
Thank you, Gary.
I hear people say that a holistic approach isn't real science and that it's a waste of money and time. Can you explain what you do as a holistic cancer practitioner?
Right, that's a good question to ask because a lot of people think that holistic is not based in science, but doing holistic nutrition therapies, you have to have a background in science, first of all. So you do a degree in applied human nutrition. And I also continued and did a 3-year holistic cancer certification. What I think people miss is they think that it's either holistic or conventional approach, but it's not. It has to be, the two go together. When you're looking at holistic, you're looking at food, at nutrition, at certain supplements, drainage and detoxification protocols. Because when you've been diagnosed with cancer, the body has to heal. So in order to heal, you need to have good quality food. That's one thing. If you're looking at disease and symptoms, usually the root cause comes from an imbalance in the organ system. We don't cure or treat anything from a holistic point of view. All we do is reinforce the organ system. And doing so, then many times symptoms and disease can be rebalanced. So that's basically the approach that we go with.
Someone comes to you and says, MJ, I've got stage 4 breast cancer. What would you line up as far as a treatment protocol would be for something
for someone
yes. like that?
Well, first of all, when you look at stage 3 and 4, people think, the statistics. You can greatly improve your odds when you when you add an approach, a holistic approach to your cancer therapies. And cancer is a word, it's not a sentence. 3 things I say to people when they've been diagnosed with stage 3 and 4 is you need to be disciplined, thorough, and determined. In today's world, we can't just go with the flow. You have to make changes. And where do these changes come from? So we have, the overall toxic load. So what do I mean by toxic load? Since 1950, we have 80,000 chemicals that's been added to the foods we eat. So we have to go back to foods that Mother Nature intended us to eat. Something that grew on the ground, something that grows on a plant or had a mother at some point. So that's the simple way to explain it. Eat real food, not something that's been done in a lab, packaged, ready to eat. Also, the water you drink. So we don't always think of the pollution in the water that we drink, but there's many, like arsenic and lead, and there's medication that finds its way in our water. So having a purification system inside your house, there's a few things you can do. Also, reducing the toxic load with your household cleaners. There are studies that has proven that a lot of the chemicals can cause cancer. So that's one part of it. But also our lifestyle, the stress in our life. We need techniques to reduce our stress because it's not one thing, it's everything combined together. You have to have a plan of attack. You have to have, positive people around you, reducing, the overall toxic that you're in contact with every day. If you've had chemo and radiation, or if you're undergoing chemo and radiation, then that's an added toxic load, which is part of the protocol or the plan that you're on. So it's even double more important to eat real food, to reduce the toxic load so that your body can heal and go through these treatments so you can come on the other side being able to heal. You're not sick because you have cancer. You have cancer because you've been sick for a long time. And that goes for any disease. So it doesn't happen overnight. So by reinforcing the organ system, when I say organ system as an example, just so that it's clearer for your listeners, is someone with high blood pressure as an example, and it goes for any disease. There's different root cause. So we're looking at the root cause of why they would have high blood pressure. It could be diet. It could be stress. So the nervous system is affected. So you have techniques to lower the stress level. It can also be a kidney malfunction where there's too much excretion of minerals. So you have to go to the root cause. So why will someone have stage 3 or 4 cancer? from a holistic point of view, we don't see cancer as a localized disease that spread. We look at cancer as a disease that was systemic and then localized. And that's why we approach it from every angle. So we're looking at your cleaners. We're looking at the stress. Are you sleeping well? What is your diet? Are you eating organic? Not everything needs to be organic, but there are certain things that need to be organic. And one thing that I would say to your listeners is to go Google the Dirty Dozen and the Clean 15. There's a list of produce that will come up, fruits and vegetables that have the most chemicals that's been sprayed. Like an average peach will have 31 pesticides. So those are the things that we can't just go with the flow. We need to reduce and we need to make changes.
What would you say to someone who has been diagnosed with stage 3 or stage 4 cancer, how difficult it is to do that 180 and totally change your eating habits? Because some people may have a tendency to just give up and think that, well, I may as well eat what I want now because I won't, I may not be able to enjoy it much longer.
Yeah, I think that the message has been said too long that it doesn't matter. What you do doesn't matter. And I always say foods and what you eat does matter. It makes a difference. I do have clients. I'm not a medical doctor, so I don't have patients. I have clients. I have clients with stage 4. I primarily see stage 3 and 4 cancers. And when they come to me, it's because they are finished their treatments or they're undergoing treatments and they're having a hard time going through their treatments, or they want to rebuild their immune system, or they've been told that there's nothing else that can be done. So what I say to them is massive changes, massive results. The body is programmed to heal if it gets the right tools to work with. And it starts with food. So it starts with what you eat. It starts with some of the supplements that are there to cleanse and to reinforce the lymphatic system.
So the lesson here with all of this is we have more control over our lives than we think we have.
Absolutely. And I always say statistics is only from the conventional side. It didn't take into account the foods you eat. What are you doing for your stress management? What are you doing to reduce the toxic load? When you have that, I mean, as I was saying previously, I have clients stage 4 that had been told that there is nothing else that the conventional side could do, which means no more radiation, no more chemo, because it's not working. And I have a specific, client that I'm thinking right now, and it's 2 years later, and he had a scan 2 months ago, and there were tumors showing in the bladder, metastasized stage 4, in the bladder and in the prostate, and there's no longer any tumors there. So there are things that can be done. And like I said, I mean, the body understands vitamins, minerals, essential fatty acids, good quality protein. It doesn't understand 80,000 chemicals that's found in the packaged goods.
What do you say to people when you tell them, to buy organic, eat healthy, and these people come from backgrounds where they just can't afford to pay those types of premium prices for good quality products?
So it's not necessarily more expensive. With the organic, yes, organic is slightly more expensive, but when I mention go Google the Dirty Dozen and the Clean 15, it's because the center of the diet should be fruits and vegetables and real food, not things that has been injected with hormones or pesticides. So when you go look at the Dirty Dozen, there's 12 that are going to come up. Those are the ones you should buy organic. The Clean 15 are the ones that you don't have to buy organic. So it's not necessarily more expensive. And learning how to sleep, if you're stressed, and doing techniques, meditation, everything is online now. You can download an app to learn how to calm down, because your stress level, you can make yourself sick with your thoughts. And when you've been diagnosed stage 3 and 4, of course you have a lot on your mind and it affects your sleep. So those are the things that you can do, and it's free.
MJ, what do you mean when you say physiology prevails over pathology?
What it means is when, from a holistic point of view, pathologies or diseases are disorders of either overload or deficiencies. So the body is either has an overload either from chemicals, from heavy metals, can be bacteria, toxins, viruses, or deficiencies, something you're not eating enough of. Vitamins, minerals are missing, or you're excreting too much. So when you have those, what we simply do is we rebalance the organ system. So we don't treat anything, and once you're able to rebalance an organ system, then the body gets back to the normal state, so how it's intended to work.
I guess there are different levels of imbalance.
Yes.
How long would it normally take a person to kind of rebalance, to come back to some state of homeostasis or whatever?
That's very individual because everyone has a health history. So from a holistic point of view, we have to do a health history. And being a holistic practitioner, you have to be a good detective because sometimes you may miss something. So the root cause has to come from somewhere. So that's the whole goal of what is the root cause, what is involved, and it's very individual. So we often hear, I'll have clients coming in and saying, oh, well, everyone in my family has type 2 diabetes. Well, you may be predisposed, that's the loaded gun, but your lifestyle and your diet will pull the trigger. So there's a lot of things we can do, and there's no time set. Sometimes I have clients coming in and we do two protocols within a month or 2 months, depending on the severity. And sometimes we're not able to rebalance the organ system.
I've heard people tend to give up, thinking that I'm so predisposed to it, then it's in my family genes, so I'm
might as well
give in.
No, and it's not always like that. It depends on your lifestyle. So we look at everything that is going on in that individual's life. So if there's someone who goes to bed at 2 and they get up at 6, so 3-4 hours sleep, so we have to rebalance that because during your sleep is when you heal. That's when you regenerate. No, when you're not sleeping, we can't function without sleep for a long period of time. So we can get by 1 or 2 nights in a row, but you need to rebalance your sleep. So that's one point.
MJ, so talk about the process when someone comes to you and says, I have stage 4 cancer. My oncologist tells me that that's it. The chemotherapy or radiation won't do me any good. How would you approach that type of a situation?
There's 3 different approaches for holistic cancer therapies. And one thing that I think is important to clarify is it's not a holistic approach or a conventional approach. The two have to be paired together. That's how I see the body is able to heal and to progress to a good balance. So there's 3 different approaches. So the first one would be someone I offer for someone who wants prevention. They've had cancer in their family and they want to prevent cancer. So what we do is we do a health history and we rebalance what is imbalanced. So if, let's say, they have acid reflux, then we would have to look at that. Type 2 diabetes, high blood pressure, high cholesterol. So those are the things that we will rebalance because, again, we don't treat or cure cancer. What we do is we rebalance the organ system. So on a prevention side, it would be that side. So we would do detoxification and cleansing and drainage protocols, change their diet and a more wholesome diet. The second approach would be for those who are currently undergoing treatments. So if they're doing chemo and radiation, there's do's and don'ts with the diet because after the first chemo treatment, within 4 days, all the mucosal layers, all the wet tissues in the body are affected, primarily the mouth and the digestive tract. So they instantly get IBS, irritable bowel syndrome. So that causes a lot of digestion upsets and they tend to not have much of an appetite. So there are certain foods that need to be avoided. And then we also, suggest pre-digested protein, high healthy fats, low in carbohydrates, or because that it's harder to digest. So we try to look at that on the second therapy. The third approach would be for those who are finished their treatment. Now, what next, as you mentioned in your question, or those who don't qualify for treatments, or those who choose not to do the conventional side. then this is an active treatment. It's more aggressive in terms of really flooding the body with dense, nutrient-dense food. So it's not calorie-dense, it's nutrient-dense. Because it's easy to have a meal that's 2,000 calories of all the wrong type. We want nutrient-dense, so juicing will be included. We will add supplements. We will do drainage protocols. So when I talk about drainage, I talk about that happens in the lymphatic system. So your cells bathe in liquid, and that's the lymphatic system, and that's where it goes it reaches out to get the nutrients it needs, but it also spits back out the garbage, and that needs to move. So exercise is important. Movement is important. Even when you're doing treatments, it's important to move. If you can't move, then we're looking at massage. We're looking at saunas, at skin brushing. It moves the lymphatic system so that the garbage can be reduced, the toxic load can be reduced.
What is skin brushing?
It's a technique where you brush your skin towards the heart, and it just moves the lymphatic system. So those are the drainage. And so those are some the three approaches that I would do.
So MJ, we've spent a lot of time talking about the work that you do and the clients that you see, and I'm sure, and we've talked about diabetics and the people that you see who are diabetics and even touching Alzheimer's patients, and you came up with a statement when you spoke at that Mo Mondays event a few months ago. You said you have a close family member who's living with Alzheimer's, not dying from it.
Right.
Can you talk about that story?
Yes. So Alzheimer's, as we know, does not have a cure from the medical point of view. But 2 years ago, we finally got the diagnosis. Just to explain a little bit where this family member was, she had reached a point where she was lost. She wasn't taking part in conversations. She was quite agitated because she couldn't find most of her items, saying that people are stealing her items. She couldn't read anymore, couldn't write anymore. Being left alone was not something that could be done.
What was her age?
She's in her 80s, and she's living with her husband. She's not in Canada. She's in another country. So I don't have access to seeing her often. But when I heard of her diagnosis, that's when I said to my husband, I said, I'm going to dedicate my time, full time, to go do as much research as I can from a holistic point of view. Because I kept thinking, if you rebalance the organ system, the body will heal. So I said, why would it be any different? So I started doing my research and read every book that there was on the market. And then looking at Dr. Perlmutter, Dr. Seyfried, Dr. D'Agostino, Dr. Fortanovsky, those are all, neuroscientists, neurologists, doctor of psychiatry. And they were all saying that there's a lot that can be done with the diet. And when I came across Dr. Dale Bredesen's protocol, which is a specific protocol that addresses Alzheimer's, and he's had success stories. He had received a grant to do a clinical trial, a human clinical trial, and that had amazing success. So I decided to implement this protocol. So after this research, I found out that the root cause of Alzheimer's is about 3 dozen causes. It's not just one cause. And that the amyloid plaque was actually a way of the brain to protect itself from the onslaught of what was in existence. So when I looked at this family member, she had type 2 diabetes. She's had type 2 diabetes for over 30 years. So that is one known cause from a holistic point of view, again, that there is an imbalance. So if insulin is high, it creates inflammation in the brain. So my first thought was, we have to control her type 2 diabetes without medication, with the diet. She also she was on a cholesterol-lowering drug. And when you take a statin drug or a cholesterol-lowering drug, it blocks CoQ10, which is necessary for the brain function. So we knew that we had to add CoQ10. At the time, 2 years ago, I said, yes, we're going to have to add certain supplements. And also that if carbohydrates increases insulin, and if insulin is an onslaught on the brain, we have to reduce that, because I had also learned that ketones comes from healthy fats, can give energy to the brain. So it was explained in a way where it's not that the brain's cells are dying, they're kind of dormant because insulin is not working anymore and the brain cannot use glucose as the source of energy. So we have to offer another source. So we have to offer ketones. So we went on this very strict diet, high healthy fat diet. And it's not like people now I'm hearing more and more clients saying, oh, I hear that coconut oil is good. Coconut oil is definitely a part of this protocol, but there's a lot more to it than that. Because, at the time when I was reading, there's 3 types of Alzheimer's. There's the inflammatory type, the dry type, or the deficient type, and the toxic type. There could be a mold, mold in the house that causes toxins. So we had to come up with, what is her situation. So at the time, we started, and I decided not to speak with her for 3 months. I said, I don't want to hear how she is. I want to see how it's going to be.
Because obviously you wouldn't see a change day by day. It would take a while to...
And day by day, I might not see the differences.
Right.
So I wanted to see. So when we made the call, I could not believe what I was hearing. She was engaged. She was laughing. She wasn't laughing for 2-3 years leading to that point. And her husband, who is the only caregiver for her, he was saying, it's really working. What we're doing, it's really working. We couldn't believe it. And she was writing letters because they're in their 80s, so they're still writing letters with the pen, pen and paper. And she was writing letters. She was able to go to church again. She was a completely different person. Now, is she back to where she was before? No. But she's functional. She's highly functional.
So she's living with Alzheimer's. She's not dying from it.
Exactly. So now it's about 2 years later, and I spoke to her last week, and she's better than she was 2 years ago, and her doctors can't believe the change. And she's not taking any medication for Alzheimer's. She's only following this specific protocol, supplements to increase the blood flow to the brain, to reduce the inflammation, to increase because the brain neuroplasticity, as you know it very well, it can regenerate.
Absolutely.
But it will regenerate if you reduce the offenders. So that's what we've done. And where she is today, her doctors cannot believe that she's not declined, because in their close area where they live, there's 6 people. Around the same age with Alzheimer's, and they're in their last phase. She was diagnosed where she was in the moderate phase, and now she is in the early onset again.
So you've basically reversed the process.
We've reversed a lot of her symptoms, and we're managing her. She's stable where she is.
Would this protocol work for someone who's in the late stages, diagnosed with the later stage of Alzheimer's?
So from Dr. Dale Bredesen's protocol, it is harder when you're in the later phases. In the moderate phase and the early onset, it works quite well. There's a lot of support that comes with it. There's a lot of testing that needs to be done too, to make sure that you address the right type of Alzheimer's, because someone could be a dry type where they're deficient, but we're going if we do the protocol for the inflammatory type, it won't work, because that's not their triggers. It's the same analogy as you have a house that has, this big crane with the ball and makes holes in your roof. Well, if you seal 1 or 2 holes and there's 7 left, your house, if it rains, it's still going to get flooded. So you have to address every one. So there might be less water coming in, but we're trying to manage it. And once we hit, the right ones that are causing the deficient or the issues for the brain, then you see the brain healing.
MJ, as we close up here now, and again, thanks, you're a wealth of information, and it's certainly opened up my eyes as to what you do. If you were to just give people a small tidbit of advice or direction, what would you say to people right now? Whether they're living with cancer or Alzheimer's or a diabetic or they don't, what would be one tidbit that you'd like to leave with people, with the listeners?
If you have symptoms, it's actually a gift that your body is giving you, and we have to listen. And the way the body can heal is by going to relearning how to eat, and you need to eat real food. And it's all about, going back to listening to what's going on in your body and not running to take medication. Because when you, like, especially for chronic, I'm not talking about acute or emergency care, but I'm looking at chronic. If you have it, because it starts there. A disease is not diagnosed until you've had symptoms for a long time. So don't ignore the symptoms that you have. And if there's a symptom, seek other answers, because there's a lot that your body can do in healing.